guys, again, Dr. Jordan Mousey here, Sports Chiropractic of Utah. We're continuing our discussion on the rotator cuff. And yesterday we talked a little bit about what it is and what it does, but today we're going to talk about the common signs and symptoms and who to see in case of a rotator cuff injury. So, the common signs and symptoms, the first one that I always ask every patient coming in with a shoulder problem is, does it hurt at night? Oddly enough, that's the most common time of day for a rotator cuff injury to bother people, is at night. People have a difficulty sleeping on it, or it just aches and it throbs. So that's one. Number two is you could just be throughout the day and it just hurts, it's aching, it's throbbing. You can't concentrate because of the pain. Now, again, remember last week we talked about trigger points. They can often do that as well. So make sure you find someone that can help differentiate between the two. And number three is with movement. If you get to about here, you're okay, right? No pain, but as soon as you get to this point and about to here, between about 70 and 120 degrees, there's usually quite a bit of pain right through here. So that is another common sign of a rotator cuff injury. And if you fit the description that we talked about yesterday of, you're an overhead athlete, or if you've all of a sudden increased a ton of work as far as volume, like you're working a ton more, all of a sudden your shoulder starts hurting, you could fit that category as well. So number two, those are the common signs. Number two, who the heck do you go see? You need to see somebody that knows exactly what they're doing. So I have a list here put together for you. It's in no particular order. I am biased, of course, but number one, sports chiropractor. I say sports because not all chiropractors are focused on helping every joint of the body. A lot of them are maybe even focused just on the spine, right? Helping your back and your neck become aligned. You want someone with a really good understanding of the biomechanics of the shoulder, of really any other joint in the body as well. Physical therapists are fantastic at helping you overcome any rotator cuff problems. Depending on your state, some physical therapists aren't allowed to diagnose the actual problem, but they can help you through it. Sometimes they need a referral from, be it a chiropractor or even the next one, which is the orthopedist. Those are the ones that would usually perform surgery, that would also prescribe rehab of any kind to either chiropractor or physical therapist, and sometimes they even do pain management, so they would be able to give you recommendations as well. Oftentimes you do need a referral from your primary care instead of going directly to the orthopedist, so just depends on your state. So check with your state and check with your primary care physician to see if they are the ones to go to. And last but not least is pain management specialists. These guys are fantastic at what they do, because what they do is they help decrease a lot of the pain so you can go through the rehab process. So an example of what they do would be kind of a steroid injection to help decrease a lot of the pain sensitivity so you can get through it. So it's very important that you see the right person that gets you to the right place. The common question I get, the last thing I want to go over is, common question is, hey doctor, I need an x-ray for my shoulder. If we're suspecting a rotator cuff issue, that's not going to be the primary method of diagnosis. You can see certain things on x-ray, but it won't show you a ton as far as the muscles go. It will show you bone stuff. But your gold standard imaging techniques will be MRI, because it shows you all of the muscles, and then a newer technique, which is called diagnostic ultrasound. What you can do is actually view the muscle as you move. It's different than the you put it on your belly and look at your baby type of ultrasound. It's actually a little bit different, but can really evaluate the rotator cuff integrity, what kind of tear you have, if there's increased blood flow because of injury, whatever may be going on. So it's another fantastic way. So recap, typical signs and symptoms are night pain, pain with movement between here and here, pain throughout the day, and just overall weakness, like you can't lift your arm up. That's the common signs. Second of all, make sure you see the right specialist. Go to someone that knows what they're doing so they can diagnose it and get you moving in the right direction to recovery. And last of all, X-ray may not show you much. MRI, diagnostic ultrasound are going to be your go-to methods of imaging. So, thank you guys for tuning in. Be sure to tune in tomorrow. We're going to talk about exercises that you can do, some of my favorites to strengthen your rotator cuff to hopefully prevent future injuries in the future, or future injuries. Thank you guys for tuning in, and we'll see you tomorrow.